Hello everyone, and welcome to the Thorncliffe Park Community Hub. My name is Tiffany Harris, and I'm a member of the Board of Directors of Flemington Health Centre. Before we begin, I'd like to offer a land acknowledgement. We acknowledge that Flemington Health Centre and the Thorncliffe Park Community Hub are situated on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, covered by Treaty 13. We recognize that land acknowledgements are just one step towards reconciliation. We remain committed to building respectful, ongoing relationships with Indigenous communities and to learn from their leadership and knowledge. I would like to welcome the Honourable Sylvia Jones, Deputy Premier and Minister of Health for Ontario, back to the Hub, and Dr. Jane Philpott, Chair of the Primary Care Action Team, for her first official visit to the Hub. I would also like to extend a welcome to members of the East Toronto Health Partners Ontario Health Team, the East Toronto Family Practice Network, and partners at the Thorncliffe Park Community Hub. Flemington Health Centre is honoured to host such distinguished guests and colleagues. 50 years ago, we were formed as a community-based primary health team to challenge the status quo. We were created to provide accessible, comprehensive, and coordinated care to a defined geography in East York. Over time, the organization has become a trusted health service provider for newcomers and refugees. Clients in our care are 54% more complex than the average population, yet only 8.8% use the emergency department inappropriately, and only 5% are readmitted to the hospital post-discharge. FHC is proud of the impact we have in keeping our community well. We acknowledge the people in the room who help make FHC a success. Thank you for your support. I would now like to pass the proceedings over to Minister Jones. Thank you.
Thank you, Tiffany, and good afternoon, everyone. It is truly a pleasure to be back here after joining Premier Ford just 1 year ago for the groundbreaking of the Thorncliffe Park Community Hub. Thank you to the team at Flemington Health Centre for hosting us today and for everything you do to provide exceptional care for patients and families in your community. I also want to acknowledge Dr. Jane Philpott, Chair of our government's Primary Care Action Team, who has joined us today. Under the leadership of Premier Ford, our government has been making record investments to protect our healthcare system, taking bold and innovative action to make it easier for patients and their families to connect to care where and when they need it. We are continuing to grow the province's highly skilled healthcare workforce, adding over 15,000 new physicians since 2018, including more than 10% increase in family doctors. In Ontario, we have the highest rate of access to a regular healthcare provider in Canada. And last year, our government invested $110 million in primary care teams across Ontario, helping to connect 328,000 more people to primary care close to home. In just over 6 months since its creation, Ontario's Primary Care Action Team, led by Dr. Philpott, has made significant strides. We are investing $300 million to build up to 17 new and expanded community-based primary care teaching clinics in communities with high rates of unattachment to primary care. And our government recently passed the Primary Care Act, which establishes primary care as the foundation of Ontario's healthcare system and sets out 6 clear objectives for Ontario's publicly funded primary care system to ensure people know that they can expect and what they can expect when connecting to primary care. Today, I am very pleased to announce that our government is continuing to build on that momentum by investing $235 million to support over 130 new and expanded primary care teams that will connect 300,000 more people to primary care this year. This investment is part of our government's $2.1 billion primary care action plan to connect everyone in Ontario to a publicly funded family care doctor or primary care team. The Flemington Healthcare Centre here in Toronto is receiving more than $4 million annually through this allocation. Congratulations. This investment will help attach more than 9,600 people to primary care through the East Toronto Health Partners Ontario Health Team. This will help increase capacity across East Toronto and reduce reliance on emergency services by meeting patients' needs earlier and more effectively in the community. Through this last investment, our government is also providing primary care teams with $142 million in operational funding over 3 years to recruit and retain healthcare workers. This funding can be used for non-physician team members, such as nurse practitioners, registered nurses, physician assistants, and pharmacists. By funding new and expanded primary care teams across Ontario, our government is protecting Ontario's healthcare system and helping connect everyone in Ontario to a primary care provider for years to come. Thank you again to Flemington Health Centre and all the healthcare workers across Ontario who provide tremendous care to patients and their families and contribute so much to the health of our communities. I'd now like to invite Dr. Philpott to share a few words. Thank you. Stay well.
Thank you, Minister Jones, and good afternoon, everyone. I am honored to be here with you today for this exciting announcement. As Minister Jones has shared, the Primary Care Action Team has been working hard since launching just over 6 months ago. And I want to thank the Minister and Premier Doug Ford for their leadership and their commitment to connect everyone in Ontario with a family doctor, a nurse practitioner, and/or a primary care team. In April, the Ontario government launched a call for proposals to create and expand up to 80 primary care teams in order to attach 300,000 more people to care. This call for proposals focused on communities that have the highest numbers of people who are not already connected to primary care, including those on the Healthcare Connect waitlist. Today, I am thrilled to share that 76 proposals, which represent over 130 new and expanded primary care teams across the province, have been approved for funding. These teams will be the front door to care, offering timely, comprehensive support led by a family doctor or a nurse practitioner. Over the next year, these teams are going to work to connect more people in their communities to the ongoing care they need. This is a major step in our plan to connect 2 million more Ontarians to primary care by 2029. We know that many have waited a long time for this, and while it won't happen overnight, teams will begin accepting patients in the coming weeks and months. Thanks to the government's historic investments, we are making meaningful progress to ensuring that care is connected, convenient, and comprehensive. And this is just the beginning. Additional opportunities for funding are coming, with the next call for proposals expected in September. Finally, I want to thank the dedicated clinicians, the family doctors, nurse practitioners, and the whole range of health professionals who are the heart of our primary care system. Your compassion and commitment every day is what makes this possible. Thank you very much. And now I'd like to invite Mireille Chung, who is the Flemington Health Centre's Director of Community Health, to say a few words. Merci beaucoup.
Thank you, Minister Jones and Dr. Philpott. We are deeply honored that you have chosen to invest in our partnership with East Toronto Health Partners, the East Toronto Family Practice Network, and many other dedicated community organizations. My name is Mireille Chung, and I serve as the Director of Flemington Health Centre, a community health centre with a proud 50-year legacy. We are delighted to host today's announcement, which marks a significant step forward in advancing team-based, community-driven, integrated primary health care. We are all acutely aware of the challenges in ensuring consistent, comprehensive access to primary care, yet by working together, we are developing innovative, effective solutions right here in East Toronto. At Flemington Health Centre, integrated care is more than just a model. It is a steadfast commitment to community and health equity. Over the past decade, we have reimagined our approach to center community voices and lived experiences, particularly those of newcomers, low-income families, and individuals facing systemic barriers. This transformation was driven by the recognition that fragmented systems were failing our clients. Through strong partnerships, co-designed services, and a focus on the social determinants of health and community governance, we have built a model that is inclusive, responsive, and accountable to both our community and the broader health system. At FHC, we are not just building an organization, we are building a movement in primary health care. This investment will allow us and our partners to expand and provide more individuals with long-term comprehensive attachment to primary care, including access to evenings and weekend appointments and 24/7 on-call services. It directs resources to the part of the health system that keeps people well in the community, addressing root causes rather than symptoms. By focusing on prevention and proactive management, we can reduce pressure on hospitals and emergency departments, allowing them to focus their resources where they are most needed. Empowering the primary care sector with additional resources will drive this movement and ensure that people and communities continue to thrive. And finally, to all health service providers and frontline staff, if you are looking to join a supportive, high-performing team, if you want to make a meaningful impact in your local community and be a part of a health system transformation, come join us in East Toronto. We are growing and we welcome you. Thank you.
We will now begin to take questions from the media. So all media present can now begin to line up behind me at the microphone. And as a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question. Thank you.
Hi there, it's Lorenda Redekop with CBC News. Every week we keep hearing about more measles cases. I know we're not supposed to ask double-barreled questions. I learned this in journalism school, but I'm going to do it, and I'm hoping for a response to both parts of the question. So let's see. Do you have a goal for when this outbreak will end? And also, what should the protocols be for summer camps? We know that these camps are going to be getting underway very soon.
Yeah, so listen, I don't have a crystal ball. I rely very heavily on the work that our local public health units are doing, the education piece where we're doing campaigns consistently talking about the benefits and the need to make sure that you're up to date on measles vaccines. Specifically as it relates to camps, Dr. Moore had a fulsome meeting with the Ontario Camps Association mid-May and went over all of the procedures and protocols that they should be aware of if there happened to be an outbreak in their summer camp. And of course, the local public health units I really have to call out because there has been some very specific parts of Ontario that have been impacted, and those public health units are going above and beyond to make sure that not only are the residents educated and informed about what is available, we as a government have made sure that there is sufficient vaccines, and we're just making people aware of how valuable being vaccinated is, not only to you and your children, but individuals in the community who cannot receive that vaccine.
Did you want to add anything, Dr. Philpott?
Excellent.
Okay. Just checking.
Thanks.
Your government is moving into more privatization with the healthcare system. We have repeatedly heard from you, people are going to be using their OHIP card, not their credit card, but over and over, especially when it comes to things like cataracts procedures, we hear that people are using their credit card. So, I feel like I did a story about this a year ago. Just recently, there were more complaints that came out in the last couple of weeks. So what are you going to do about this?
So I want to be very clear. Cataract surgeries in communities have been in Ontario for decades. Did we expand a number of years ago into foreign communities that had very high wait lists for cataract surgeries? Absolutely. And as a result of that investment, we've actually seen the wait times for cataract surgeries decrease. One of the things that we are doing as we are expanding options for community and diagnostic centers is we have strengthened and ensured that individuals who are having services in those community centers have the ability to have their concerns, their questions, their complaints raised with the patient ombudsman, something that frankly didn't exist previously. So we're going to make sure that as we expand in community, to make it convenient for people and to continue to decrease the wait times, we are also putting in the controls. Accreditation Canada, again, something that we did not have previously. Now these surgical and diagnostic centres, as they expand, will be under Accreditation Canada so that people have faith and trust that when they go there, they can see very clearly what can be charged by the clinic, what is covered by OHIP, and we'll continue to do that work. And those are pieces that didn't exist 5 years ago, decades ago.
Hi, Minister Jack Allen from the Trillium. Sorry. I was just wondering if I could get your take on what is the value of a non-medical, non-religious exemption to vaccine requirements? Why should those children be allowed to be unvaccinated in public schools?
So we have had the ability for people to apply for exemptions, again, for decades in the province of Ontario. Measles has been literally available as a vaccine for almost 50 years in the province of Ontario. We have always had the opportunity for people, for a number of reasons, including religious, to be exempted from receiving those vaccines. But there is a caveat that goes with that. And that caveat is when there is an outbreak, when there is an issue in that community, those are the young people that cannot go to school anymore. So people need to understand what it means to ask for that exemption and also what it means if they choose to take it.
We're in the middle of a heat wave. It's going to drag on for another couple of days. Plenty of classrooms are without air conditioning. Given the health risks of heat, I wanted to ask why that is. Why are so many classrooms without air conditioning, and what, if anything, does your government plan to do about it?
Well, as you know, the Toronto District School Board and others across Ontario have put plans in place to make sure that, for example, their students are not out in the heat and the high heat parts of the day. They are making sure that they're modifying their classrooms and where those classrooms are located while the heat wave continues. And I will leave it to the school boards to make sure that they put the pieces in place to keep their students protected, because each school is different and unique for what they are looking at in terms of where the students are best protected and where they can modify their learning environment.
Good afternoon, Minister. Mark McAllister from City News. When all the drug consumption sites were closed and the efforts were made to try and get heart hubs in place, I believe you were expecting that agreements were going to be in place as of April 1st. Why aren't all of those agreements in place and signed at this point? So
first of all, the consumption and treatment sites that applied and were successful, all of them were successful, to transition into heart hubs are operationally started. We have had, as you can imagine, as we expand the program into communities that didn't have a consumption and treatment site, but wanted to have the option of providing a pathway out of addiction and support for mental health. Some of those organizations are taking a little longer to find the appropriate space to work through the recruitment and hiring, and that work is ongoing. I can assure you that the Ministry of Health is working very closely with those individual organizations, depending on where they are in terms of, are you still looking for space? Are you still hiring? Have you formulated the transitions and the partnerships within those communities? Because keep in mind, heart hubs are much more than just consumption and treatment. They ensure that we focus on the treatment aspect, and that could be today providing primary care. Tomorrow it might be assistance with your mental health issue. But all of those pieces together mean that multiple agencies and organizations are coming together to provide these services, and some of that work takes a little longer.
We also know that you've extended some of that startup funding to help with that process and getting these heart hubs fully up and all operational. Is there a time when that funding runs out and you are expecting that all those services are in place?
I absolutely expect the successful applicants to be operationalized as quickly as possible. As I said, there are going to be examples where perhaps modification, renovation has to happen at a particular site. So that's why I say we're working individually with these organizations across Ontario to make sure that whatever the barrier is, we're assisting at the ministry level.
Hi, Minister. Siobhan Morris from CTV News. Dr. Philpott could join in on this one if you want. I'm just looking for generally some advice you have for Ontarians in this hot weather. How should they be taking care of themselves? And if there's anything the ministry is doing or if it's all sort of happening at the public health level.
Yeah, this is one yet another example where the local public health units really play a very important role. I know that the City of Toronto, through their public health unit, are providing bottled water for individuals. To me, this is, more than anything, the time to reach out to your friends, your neighbors, to make sure that they're doing okay. The calling 211 for a non-emergency checkup, wellness check, all of that can be very helpful. We've got to look after each other for this, and I know that, for example, in the City of Toronto, they've opened additional cooling centers, so we'll monitor and offer assistance where needed, but I have to say the local public health units, the City of Toronto, seem to be on top of this.
Last question.
And just, I guess, as part of this is probably more in the realm of Ministry of Labour, but as Deputy Premier, I hope you could weigh in on this controversial closure of some pools in Toronto. The city said they were citing occupational health and safety for their workers. Does that make sense?
I will leave that to the City of Toronto. Thanks, Siobhan.
Thanks so much, everyone. That concludes our media availability, so thank you, everyone, for attending.